Hello everybody, my name is Julian John, Associate Director for Mind Cymru. Mind Cymru is the organisation that leads Mind's work in Wales. I'm delighted to be at the Children's Social Care Research Conference, and I've been asked to talk about Mind's work in Wales, our services, our strategic priorities and any new developments. I think it's important to start with that headline statistic that 1 in 4 of us will experience a mental health problem at any one time. And this slide just gives an example of some of our campaign work. And one of the reasons that we campaign as an organisation is so that we can raise awareness around mental health and also how people can access our services and what it is that we need to do to influence policy in Wales. So how do we make a difference? So the strategic focus for Mind's work at the moment is centred around these key priorities around we change minds, support minds and connect minds. And the purpose of our work in Wales is written there, which is that we are led by the experiences, priorities and aspirations of people with mental health problems in Wales. We use these insights to change Welsh policy, improve public attitudes and provide life-changing support at a national and local level. So Mind is a federated organisation. So in Wales, we have 18 local Mind organisations centred across all corners of Wales, covering the nation and all 7 health boards and 22 local authorities in Wales. So we're really proud of the work of our local Mind organisations, which are centred in communities across Wales, delivering services that are bespoke and specific to the needs of those communities. The key priorities for us at the moment are influencing the Welsh Government, particularly in relation to the revised 10-year mental health strategy for Wales, how we engage in suicide and self-harm strategy and influence those plans for suicide and suicide prevention in Wales. We're engaged in the legislative framework, the Mental Health Act and the measure, implementation of the whole school approach to mental health and the new curriculum. And we've got a really good example of a recent campaign called Sort the Switch that looked at the transition for children and young people from children's services to adult services. The other priorities then are delivering nationally commissioned early intervention services, always delivered in partnership with local minds. And I'll talk about an example of the supported self-help programme that we've been delivering across Wales over the last 3 years. We work in partnership with Time to Change Wales and host Time to Change Wales in partnership with Adferiad. And the key focus in this phase 4 of the National Anti-Stigma Campaign, is to focus on ethnic minority communities and specifically addressing some of the challenges that people face in terms of accessing services. There's new flagship programs to develop new ways of delivering life-changing support. So we're doing some work around the missing middle, in partnership with primary care, child and adolescent mental health services. And we've been working in partnership with the Stroke Association to look specifically at the mental health needs of stroke survivors. So that programme is called Rebuilding Minds After Stroke. We know that we need to embed lived experience leadership in our work, and we've been engaged in national conversations across Wales, listening to people's experiences of using mental health services, so that we can take those experiences to influence our policy work in Wales. Our other priorities are increasing our reach and engagement and improving the quality and content of our information pages and social media presence, increasing our work in the Welsh language space, and continuing to promote programmes and policy. So back to the National Supported Self-Help Programme. This programme was initially developed through emergency mental health funds during the pandemic. We had the opportunity to roll this supported self-help programme across the nation in partnership with 18 local minds. And we've been able to provide services to over 18,500 people since the inception of the programme back in 2020. The programme is a free 6-week guided self-help programme, and people can engage in a series of pathways that address their anxiety or their mood or their stress experiences, as well as developing new programmes of work. But we're really pleased to report that of those 18,500 people, 85% of those people engaged saw improved levels in their presented anxiety, as well as 86% improved levels of depression, and 84% improved sense of well-being. 17% of the 18,500 people were young people aged between 18 and 25, with 51% reporting as experiencing poverty, and 7% of the 18,500 people that engaged in this programme were from racialised communities. Other programmes that we deliver, Mums Matter is a perinatal mental health support programme. It's an 8-week sessions delivered in person or online, designed for mums, by mums with their babies and children of up to 3 who feel low, anxious or overwhelmed by motherhood. People can self-refer or be referred by a healthcare professional, and we work in partnership with healthcare professionals in the perinatal space. And there's an example here of the Deputy Minister with colleagues in our Mid and North Powys Mind organisation, where the programme has really excelled. So work in development, I already mentioned at the top of the presentation that we've been working in partnership with the Stroke Association. So we've been co-producing an intervention to support stroke survivors with their mental health. We know that access to physical health interventions for stroke survivors can be effective, but often people surviving stroke talk about the impact that stroke has had on their mental health and well-being, and we know that the services for stroke survivors around their mental health are pretty limited across Wales. So we're looking to collaborate with the Stroke Association to really understand what it is that we can do in that space. So we've been going through a process of service design and testing new ways of working and understanding the needs of stroke survivors by putting them front and centre at designing some of this work. We've also been developing some work in the missing middle. We know that the mental health needs of children and young people have been adversely affected by the pandemic. So we've been working in partnership with primary care CAMs, and we've been piloting a programme of work in partnership with 3 local minds in the Swansea Bay and Cwmtaf Morgannwg Health Board areas, so that we can provide early intervention support services to children and young people who might not meet the CAM's threshold. So again, working in partnership with statutory colleagues who can gatekeep access to that service and ensure that the needs of children and young people can be met by our Missing Middle programme. And also we provide, in partnership with Adferiad, the Time to Change Wales campaign, which is the National Anti-Stigma campaign, which is a social movement to tackle mental health stigma and discrimination in Wales. It was established in 2012, and we're now moving into the 4th cycle of funding from Welsh Government. So the current focus is on engaging and reaching diverse communities that experience poverty, and we've been working over the last decade with volunteers and people with lived experience that we refer to as Time to Change Wales champions, and those champions help shape and drive forward the campaign's mission by telling their own stories and normalising experience of mental health. We've been working with employers across Wales so that we can enable employers to pledge to the anti-stigma campaign, which is a framework for transforming organisations' cultures to tackle workplace mental health and stigma. And recently we've launched a Room to Talk podcast, and I would encourage anybody to download that podcast in any of their streaming apps, because it's a really interesting debate and conversation around stigma and the real impact that that has on people's lives in Wales. So really delighted to give this 10-minute presentation. I'm really conscious that that was a whistle-stop tour of our work in Wales, but more than happy to kind of pick up any questions if anybody has any, and you can email me directly on j.john@mind.org.uk. Thank you very much for your time.